It's Wednesday, February 10. This is the news on PBCJ. I'm Simone Absalom Gale. Effective today, February 10, the island-wide curfew will commence at 8 p.m. instead of 10 p.m. nightly and end at 5 a.m. until February 24. The announcement was made by Prime Minister Andrew Holness as he gave Parliament an update on the government's management of the COVID-19 pandemic on Tuesday.
The gathering limit will be reduced from 15 persons to 10 persons, and this is nationally. So let me spend a little time on both measures. The curfew has proven to be the most effective measure, but it is the most expensive measure because of the impact it has on the economy and on business. But the curfew certainly helps to filter non-productive activities.
The Prime Minister says the security forces will be exercising greater vigilance to ensure that the curfew hours as well as other measures in the Disaster Risk Management Act are complied with. To date, more than 17,000 Jamaicans have tested positive for COVID-19. The highest daily numbers have been recorded in the last few days. Mr. Holness says the increased numbers being tested are as a result of island-wide surveillance and not random testing.
Meaning that we're not just going to see somebody in the street and say we're testing you or we're testing you. The basis of our public health response, whether it is for COVID or for dengue or for, it is the surveillance. And what we have invested in is to increase our capacity to go into communities and observe what is happening and report back to our health professionals and then make interventions in those communities. So we are able to tell you with great accuracy what is happening in St. Thomas. We see a cluster emerging and we move our resources into St. Thomas. We put all the resources around St. Thomas and we bring the situation under control. We are seeing less hesitancy towards being tested. I recall, Madam Speaker, when we started to do the mobile testing, when the buses were going into some communities, the people would just run and hide. I remember we were trying to do it in a community in Montego Bay and people just wouldn't come. Now, and in other communities. Now, Madam Speaker, persons are coming, asking when is the bus coming, I want to get tested. So that would also contribute to the increased numbers of persons being tested.
Mr. Holness notes that the rising numbers and the capacity of the island's hospitals to facilitate the number of people being hospitalized is concerning. He says the government cannot dedicate the entire capacity of Jamaica's healthcare system to COVID-19 alone.
The island-wide hospital census shows significant occupancy levels across the health regions. Currently, the Western Health Region is at 83% of capacity. The Southern Region is at 76% of capacity. The Northern Region is at 66% of capacity, and the Southeast Region at 59% of capacity. Additionally, there are a number of hospitals across the island that are at or above 90% occupancy levels, and this would include the Maypen Hospital, the Kingston Public Hospital, and Spanish Town Hospital. And those are our major hospitals, and they are at or above 90%. So there may be capacity in other facilities spread across the island, but it may not match where the population centers are. So what we are seeing here, having interrogated this data, is that there is need for a greater sense of urgency.
Responding to concerns regarding the new strains of the SARS-CoV-2 virus, the Prime Minister says samples have been sent abroad for testing.
the Ministry of Health and Wellness has advised that as part of their surveillance activities on new variants, they have sent off for genome testing, genome sequencing, 14 positive samples from travelers from the UK. And later this week, they plan to send off another 101 samples randomly selected by parish. The results from genome sequencing will give us better insights into how prevalent the new variants, if they exist, may be in Jamaica.
Mr. Holness says the recent surge in Jamaica's case numbers should serve as a reminder to all that the pandemic is not over. He is urging the public to be responsible. We now take a look at the latest COVID-19 clinical management summary from the Health and Wellness Ministry.
The COVID-19 pandemic claimed 3 more lives on Tuesday, February 9. The latest victims are a 76-year-old man from St. James, an 87-year-old man from St. Elizabeth, and a 70-year-old man also from St. Elizabeth. The death toll now stands at 362. 207 new cases were also recorded over the period. That leaves the overall tally at 17,908 with 4,953 active cases. Kingston and St. Andrew returned the highest positivity count with 72, followed by St. Catherine with 38 and Manchester with 33. Clarendon has 21, while St. Elizabeth has 11. St. Thomas and Portland both have 7 cases. Hanover, St. Mary, Trelawney, and Westmoreland all reported 4 cases. St. Anne and St. James had 1 each. 44 new recoveries were reported, pushing that total to 12,406. 171 persons are currently in hospital, with 34 displaying moderate symptoms and 13 critical. For the news on PBCJ, I'm Gabrielle Thompson.
Prime Minister Andrew Holness says the government can no longer absorb the cost of state quarantine. Speaking in Parliament Tuesday, Mr. Holness sought to assure that the quarantine cost will not be too exorbitant for those who may require it.
The government of Jamaica has been very generous, very considerate, and it has come at great cost to taxpayers that when we have to put in place state quarantine, the government pays. And we have been paid. Madam Speaker, as a matter of policy, the government cannot continue to do this. And so if it becomes necessary for state quarantine to be implemented, then those persons who would be so affected should take this now as notice that you would have to be prepared to pay.
His comments follows concerns in the public sphere that people returning to the island have not been practicing the 14-day quarantine order set by the state.
So we have no hesitation in saying to the security forces that they must now go full force as much as they can in enforcing the orders for quarantining at home.
Those in favour? Those against? The ayes have it.
Parliament has approved the extension of the zones of special operations in August Town, Greenwich Farm and Denham Town in Kingston and St. Andrew, and Mount Salem in St. James. That did not stop opposition leader Mark Golding for questioning the renewal of these ZOSOs every 60 days.
We recognize that the zones of special operations represent an attempt to grapple with the phenomenon of high levels of violent crime, gang-related and other crime in communities. And the legislation does provide some additional tools to the security forces for doing that. The difficulty I have is the fact that those tools the minister has indicated are working, but the use of the zone of special operation legislation has been so limited over the 3+ years of its existence. So really it's 4 quite small communities in the scheme of the areas in Jamaica which high levels of violent crime exist. So, for example, in the case of Denham Town, there are surrounding communities which are from time to time impacted by high levels of violent crime. And they don't have the same level of security that Denham Town has enjoyed because the resources are being deployed there under the ZOSO. And one wonders really in terms of an overall crime fighting strategy for the country, you know, whether we shouldn't be looking at the elements of the ZOSO legislation that, from a law enforcement point of view, have been helpful in reducing the levels of crime in those communities on a sustained basis, and seeking to learn from those lessons and see to what extent we can apply them on a broader basis.
Member of Parliament for St. Andrew Eastern, Favour Williams, stands in support of the extension, citing its benefits to parts of her constituency.
Augustown is breathing again, thanks to the men and women of the Joint Security Forces who are awake while the residents sleep at nights. I'm standing with the people of Augustown to rid the community of gunmen. The zones of special operations is working. Social intervention has already started. Last week, I attended a JSIF function at which 25 micro-entrepreneurs from Augustown received grants and equipment to expand their existing businesses ranging from food and beauty services, garment manufacturing, car care service, window and block making. 2 schools, Augustown Primary School and Hope Valley Experimental, that cater to a large population of special needs students, will see rehabilitation of classrooms. Augustown Primary School will get a long-awaited infant department.
The law reform zones of special operations, special security and community development measures is aimed at curbing crime through security force occupation of vulnerable communities and preserving human rights during the period of occupation. It's projected that by 2050, deaths by antibiotic-resistant bacteria will climb tremendously. That's the word from winner of the Best Overall Oral Presentation Award at the 2020 National Health Research Conference, Kevin Graham. Addressing a recent JIS think tank, Mr. Graham spoke of the implications antibiotic-resistant bacteria has as a result of persons not taking the full course of medication when prescribed.
Antibiotic resistance is a very climbing issue, both in Jamaica and international. And it all starts because patients are not taking their antibiotics on time, they're skipping them, they're sharing them, they're not completing the full treatment. And in small cases, healthcare professionals are prescribing antibiotics for less severe infections. Now, this increases the prevalence of antibiotic resistance bacteria.
He's also advising healthcare professionals to properly examine patients and ensure that they give antibiotic treatment to the most severe infections.
It mostly affects patients with a compromised immune systems, persons with chronic infections, diabetes, cancer. Those persons have compromised immune systems. So these bacteria, Salmonella, popular in food spoilage, E. coli, popular in UTI infections, they are normally the ones that are going to cause effect on these patients.
According to the Centers for Disease Control and Prevention, antibiotic resistance happens when germs like bacteria and fungi develop the ability to defeat the drugs designed to kill them. The Program for Advancement Through Health and Education, or PATH, was launched in 2002 and is administered by the Ministry of Labour and Social Service. Hailed as the island's flagship social assistance program, it provides cash transfers to poor families. The program was put onto the spotlight on Tuesday at the Parliamentary Public Accounts Committee. One of the issues highlighted was that nearly $550 million in much-needed benefits has been sitting idle in bank accounts rather than benefiting vulnerable Jamaicans. PAC member Juliet Holness put the question to Permanent Secretary in the Labour Ministry, College Roberts Risden.
Still in your account,
or is some third party holding these monies to pay out to beneficiaries? Who benefits from the monies dispersed from central government through the Consol Fund, but not collected by beneficiaries?
Unclaimed funds are periodically recalled by the ministry. So we have different modalities that are paid. We have checks, which as it is in cash, it is deducted from our bank account, right? We have the cash card, which cards are uploaded and persons can go and use the card at point of sale and whatever. At certain times periodically, every 2 months, any unclaimed balances, and it's not any unclaimed balances, let me qualify that. If the card has not been accessed and used within a 4-month period, which represents 2 pay cycles, the funds that had been uploaded to that card is recalled.
Concerns were also raised over $271 million in unclaimed benefits returning to government's coffers. There were calls from PAC members for paths to get a redo.
It is very, very, very hard, PS. It gets emotional at times because just speaking about it, I am reflecting on people who comes to the office on a daily basis. For a little help, sometimes it is them say, Mr. Clark, our boss, can you give us just a bus fare? And I say, but if I give you the bus fare, what you eat when you go to school? And I have learned no empty barrel can stand. And therefore they need substance and it is not that they are dunce, it's not that they don't want to go to school. It's simple, they can't afford to be there. And therefore if the state is going to assist, we hope that it assists on a wide scale base. When I hear of $270 million going back to consolidated fund, and I said, Jesus have his mercy. Miss Tiny has 6 children, 1 in a wheelchair from the day the child was born. You have Mr. Samuels who live beside Miss Tiny, who lost a leg and can't work again, and is unable to find food. It is just heart-tearing.
Time now to look at the financial movements. Here's a business report with Gabrielle Thompson.
In Tuesday's trading session, the JSE Combined Index declined by 5,216 points to close at under 400,000 units. Overall market activity resulted from trading in 83 stocks, of which 28 advanced, 40 declined, and 15 traded firm. The Junior Market Index advanced by 6 points to close at under 3,000 units. Stocks advanced for 138 Student Living Jamaica, Caribbean Assurance Brokers Limited, and Siboney Group Limited. Stocks declined for Barita Investments Limited, CAC 2000 9.5% preference shares, and Caribbean Cement Company Limited. Trading firm were Access Financial Services, AMG Packaging and Paper Company Limited, and Berger Paints Jamaica Limited. Trans-Jamaican Highway Limited was the volume leader with 6.9 million units, followed by Deramon Trading Company Limited with 5.6 million units, and Lasco Manufacturing Limited with over 4 million units. Now for the foreign exchange. The US dollar on Tuesday, February 9, ended trading at $150.29. The Canadian dollar sold for an average $117.84. The pound sterling traded for $209.84, and the euro ended trading at $186.61. Oil extended its rally for a 9th day on Wednesday, its longest winning streak in 2 years, supported by producer supply cuts and hopes that vaccine rollouts will drive a recovery in demand. Brent crude futures rose 42 cents to $61.51 a barrel. West Texas Intermediate crude futures added 32 cents to $58.76 a barrel. And that's it for the Wednesday edition of the Business Report on PBCJ. I'm Gabrielle Thompson.
Snoring is a common affliction and one that we typically accept as normal. But hold on, snoring might be an indication of sleep apnea, and that can be cause for concern. Snoring can be caused by constriction of your airway. Snoring Tiredness in the morning and throughout the day can indicate that something may be limiting your airway or closing your airway when sleeping at night. In this episode of Living Healthy, HD Jazz explores this issue.
Here in the Blue Mountains, I can hear the wind rustling, I can hear birds chirping, and if I listen really keenly, I can hear the river down below. Beautiful, tranquil sounds that can just relax you, especially during sleep time. But there are sounds when you're sleeping that can create a totally opposite effect, like a snoring bed partner. Have you ever been in an open field when the wind is blowing? It sounds very different than if that same wind is pushing through a tunnel. It's much louder. That's the same premise behind snoring. When your airway is wide open, you don't hear anything. When your airway is constricted, you make a loud noise, and that translates into snoring. Snoring, tiredness in the morning, tiredness throughout the day may be signs that something is limiting your airway or closing your airway when you're sleeping at night. This condition, where it is closed off a little bit, is called hypopnea, and when it's limited so much that the body is not getting oxygen, that's referred to as apnea. Many people have apnea and they're not aware. So if you have a partner that makes a lot of noise when he's sleeping, if your wife is always tired in the morning, if you can't drive from here to Montego Bay without falling asleep at the wheel, if you're always falling asleep at the stop sign or the stoplight, it's not conclusive, but it is an indication that you may possibly have airway issues. Sleep hypopnea or sleep apnea. The air is not able to flow through clearly, and so our body doesn't function optimally. So while I'm not saying that everybody who snores has sleep apnea, snoring coupled with other things like morning fatigue, daytime sleepiness, falling asleep at the stoplight, an inability to travel from Kingston to Montego Bay without having to stop and rest, those are all signs that you may not be resting well, and you may not be resting well because of airway issues. If you're questioning if that could be you, see your physician soon. Listen, catch you next time on Facebook, YouTube, and the LFD website. See you next time on HD's Jazz.
We go now to regional news. In the Bahamas, the Minister of Health says the government is exploring the introduction of a COVID-19 vaccine passport to make traveling in and out of the island easier.
According to Wells, the information will be uploaded to a digital platform.
We are looking at the possibility of the kind of, I think you're talking about the health passport, where you can say that you were vaccinated, and the information is put up on a digital platform. As you know, the Bahamas has already been transformative, evolutionary, revolutionary in our approach to COVID. We were the first country to institute a health visa for folks to travel in and out of the country, a digital one. Now a lot of other countries are moving in that direction, but we are also looking at elevating that platform to the possibility of doing the health visa passport.
In the meantime, he says the arrival of vaccine doses is still scheduled for the end of this month.
We're still looking to receive it probably by the end of February, beginning of March. We have had no change in the timeline from the WHO, from COVAX, and so we are expecting that we will receive those vaccines, the 100,000 doses. And of that, I think that the vaccine committee would have already spoken to how much in total the country will be receiving.
In St. Lucia, the National Workers Union is seeking caucus with regional unions to determine its next course of action for Liat severed employees in St. Lucia. Regional heads of government have been asking to help cover the cost of severance entitlements, over 70 million EC dollars, to former employees of regional carrier Liat.
The National Workers Union representing Liat employees in St. Lucia is in the process of arranging a meeting with regional unions in the Caribbean following a receipt of a letter dated last month, January 2021. The letter was addressed to the government of various islands where Liat operates. It was also copied to the CARICOM Secretary General and several of the trade unions across the islands, including St. Lucia.
Our objective is to see as best as possible how these persons can get paid as quickly as possible, because as you would appreciate, the airline has been pretty much not flying now for almost a year. So these persons have been either laid off or made redundant for quite some time, and they need some certainty, they need some assurance.
According to the NWU General Secretary, the former employees have been placed in an unbearable position, specifically during these times. The NWU stated the harsh reality is that the statutory period has elapsed in terms of employment made through redundancy. St. Lucia-based employees of Liat are requesting 100% of their severance and vacation pay.
We're not sure as to whether the administrator has received any responses from the regional government. But from the union standpoint, the regional consultative mechanism that is in place, we will be participating in that in the next few days to see what is the next course of action that the regional unions will take.
Another 103 employees of the collapsed regional airline Liat are reported to be terminated, joining close to 600 already on the breadline following the demise of the carrier. This has been revealed by Cleveland Seaforth, the Antigua and Barbuda court-approved administrator of the company, in a letter dated January 22, 2021, and addressed to Prime Minister of Barbados Mia Mottley and 8 other Caribbean community CARICOM heads of government, in which he warned the CARICOM counterparts that they would be exposed legally unless some effort was made to pay the affected workers. At least 30 employees of the collapsed regional airline Liat in St. Lucia have been terminated. Cecil Actel, MBC Prime.
In sports, we look to cricket. Jamaican Nkrumah Bonner, who played in the supporting act in West Indies' record-breaking run chase against Bangladesh in the first day, says it's time to devise plans to succeed again as they look to be consistent. The second test will be played in Dhaka and starts Wednesday. Bonner spoke with Newsroom Guyana.
Starting from zero again. So obviously we have to go over the processes, we have to practice and prepare well. It's going to be a different wicket, different ground, different everything. So it's important for us to assess again. And as I said before, going over the processes and ensure we do them well. I like to win cricket games. I hate losing. That's been in me from I was young. Obviously I've played with Jamaica. We won 5 years straight, and that's a good feeling within the dressing room. Obviously it's been a while. We haven't won away from the Caribbean. And obviously we are trying our best to make this one possible. Not only for us, man, but for the people back home. They have been supporting us right through, and we really want to make them proud. I mean, around the discussions, we're trying to keep us level. We don't want to be overconfident or take anything for granted. The Bangladesh team is a good team, especially in their own conditions. So obviously, we know it's going to be tough, and they're going to come hard at us. And we're looking forward for that challenge. For them losing Shakib Al Hassan, it's a great loss for them, not only in his performance, but the experience that he brings on the field as well. Obviously, they're still a good team, so we're not going to take anything lightly. We're going to do the same preparation that we've been doing. I think we've been preparing very well. And, we're taking all the measures now, to even prepare even better right now for this test match, because as I said before, it's really important, not only for us, but for the people back home as well.
And that's the news. Thanks so much for watching PBCJ. Remember, we are the People's Station.